As you all know, last night, Malaysia announced a movement control order in response to a significant increase in the number of COVID-19 cases in recent days. Our Prime Minister has spoken with Malaysian Prime Minister this afternoon, and they have appointed Senior Minister Teo Chee Hean and Senior Minister Ismail Sabri, respectively, to coordinate our response to the COVID-19 outbreak, particularly on measures where we can work together or where the actions of one country may impact the other. I have also spoken to my counterparts, Dr. Adam Baba, and we understand their need to implement these measures urgently, and we agreed to continue to work together. With this movement control order, I know many are concerned about the affected workers, and I have Minister Josephine Teo with me. Ministry of Manpower has been working very closely with our employers as well as our tripartite partners to address these issues. And I'll now invite Minister Teo to share our efforts.
Well, there are three important points to note. The Malaysian government's announcement impacts both work pass holders as well as our own citizens and permanent residents who commute daily. Many of these workers are hired by companies that provide essential services such as healthcare, security, cleaning, transportation, waste management, facilities management, and logistics. Even for companies which do not provide essential services, they employ Singaporeans, so we want to ensure that their businesses are not severely disrupted. This is why MOM has been working with our tripartite partners to support the affected companies if they need the workers to stay in Singapore, and the way to do so is to help them find suitable accommodation. There are a number of housing options. We have issued an advisory on this. First, the employers can encourage their affected workers to stay with their relatives, friends, or colleagues in Singapore who may be able and willing to accommodate them for a short period. Now, this option is probably the most comfortable to the affected workers. Second, if staying with relatives, friends, or colleagues is not feasible, then the employers can consider hotel and dormitories. We have a list, and we will link them up. The third option will be rental options, and there are real estate agents who can help. Whatever the arrangements, we appreciate that businesses have had to respond very quickly and incurred some additional costs as a result. Therefore, we have worked out financial support. For every affected worker, we will provide the firms with a support of $50 per night for 14 nights. More details on how to apply will be announced subsequently. So that's what I have to share for now. Yeah.
Lawrence?
Good evening. We've always said that the land crossing with Malaysia is something quite unique and needed special consideration given the high volume of people and goods coming through the land checkpoints. And that's why we've been discussing this matter bilaterally. But in the recent days, the Malaysians, seeing the seriousness of the matter within their own country and the rise in numbers, decided that they needed a swift and urgent response, and hence the measure that they have just put in place. We understand why they have to do this, and we are, as Minister Gan had said, continuing our discussions with them, this time going beyond just the work group amongst the health officials, but because this is now a measure that requires a broader response, we have coordination at a higher level and a broader team of people discussing on all the different coordination that is required and the next moves that are required. As Prime Minister Lee has said, the Malaysians have assured us that they will continue with the flow of goods and cargo, but because of this measure, Malaysians commuting to Singapore daily will be affected. And that's why we are now making these moves to work with employers to see how we can provide accommodations to workers who are affected so that they can continue working in Singapore and so that the essential services can continue being delivered to Singaporeans without any disruption. The discussions amongst the officials, of course, will also look at what we need to do beyond this period of beyond when the measures are put in place, because at some point, if the measures were to be lifted on the Malaysian side, we certainly don't think we can go back to business as usual. Right? So extra precautions, as we have been saying, extra precautions do need to be taken at the border, at the land checkpoints, and so these coordination mechanism will allow us to continue our conversations with Malaysia on what are the appropriate precautions, both in the interim and also beyond this 2-week period. We recognize that the measures will pose inconvenience to all of us, but we should take this in our stride. And importantly, in fact, the measures that the Malaysians have put in place will help to control the transmission of the virus, not just within Malaysia, but also across the border. So while the measures will cause inconveniences and disruptions, they will be helpful in allowing both sides to control the spread of the virus. So we will make the adjustments where necessary when it comes to the workers, but we also will need to continue with all our efforts to limit the number of imported cases, to limit the spread of the virus within Singapore itself. So let me just touch on this quite briefly. With all of you would know that we have a range of measures, travel restrictions, our contact tracing and quarantine to contain, and then the social distancing measures, the 3 broad strategies that we have already put in place. We are very concerned about the fact that we are seeing more cases, and these are imported cases. And these imported cases are quite different from, the word imported cases would suggest that they are travelers coming in, visitors, tourists, but in fact they are not. Majority of the imported cases that we have been seeing in recent days are Singaporeans, permanent residents, long-term pass holders, residents of Singapore who have been overseas and have come back, and then they have been infected during the time that they are overseas. Fortunately, we have been able to pick them up, and they have been responsible. They're sick, they report to the doctor, so they have not been mingling around within the community. So the minute they come back, we've been able to pick them up, and we have been able to contain these cases. But it only takes 1 or 2 cases to go out of the containment in order for this to spread very widely. So we really want to limit the number of imported cases, and we have to do more. So we would encourage and we will call on all residents of Singapore. We have already put out the travel advisory to defer non-essential travel, and we would call on everyone to comply with this advisory and defer your travel plans. There is really no need to travel. If there is no need to travel, please don't travel during this period. It puts everyone at risk. You put yourself at risk, and you put your family members and the people around you at risk. So we would really ask Singaporeans, residents, to really think through before you make any travel plans. If they are really, really necessary, yes, we are not stopping people from traveling. We are not doing that. We are not locking our borders, shutting down our borders and stopping people from traveling. But please, we encourage and urge people to defer all travel at this particular juncture. We also would, the tripartite advisory groups, partners have put out an advisory to make the point very clear that if anyone will still decide to travel during this period, now that we have put out an advisory to defer all non-essential travel. If anyone were to still choose to travel, the employer is entitled to make the person take his own leave when he comes back in order to serve that 14-day stay-home notice or a leave of absence that the employer may so wish to impose on that person. Right? So it's not quite like the current situation where if you are caught or if you are coming back, a stay-home notice is issued to you, you can take 14 days stay-home notice and it's paid leave. Now that the advisory has been put out, if you still choose to travel, the employer can ask you, or the government may issue you a stay-home notice. The employer may also ask you out of an abundance of precaution to stay at home for 14 days, and that will not be on a paid leave. That will be on the person's own leave. And the employer will also not be entitled to claim the $100 allowance that we have put in place to help employers. Right? Because this is very clear. The advisory has already been put in place. You are not supposed to travel, and if people still wish to, then they have to take responsibility for their actions. So again, we would just encourage everyone, defer all travel plans during this period. Many other countries are already tightening and doing all they can to limit the spread of the virus. So really, if there's no necessity, do not travel. Let's reduce the risk, reduce the number of imported cases, and reduce the risk of the virus, more cases coming into Singapore. So that's on the travel side. Beyond that, we have a series of other measures which we will continue to review and update very regularly, given the speed at which this is spreading, and you will hear from us as we have new updates.
Questions? Maybe the gentleman at the back.
Minister Faris from Bloomberg. A couple of questions. Given that Singapore made an exception for Malaysia, in terms of the quarantine and so on, and that, Malaysia suddenly announced a lockdown, was the government taken aback by this? Was there any communication from your counterparts before they announced the lockdown? And you also have Singaporeans as well as expatriates who are based in Johor, and they work in Singapore. So how are you facilitating that? Will there be some sort of exception made that you will discuss with your counterparts? And last question is, with the virus still, no signs of abating, do you think that there is an absence of global leadership to actually steer nations to a safety zone, perhaps?
You want to elaborate?
Like we said, we've been discussing this matter with the Malaysian side, and I think they had considered this also within quite a short time frame because of how quickly they saw the number of cases rising. And so it's something we understand. It is a very urgent matter. After the events that saw so many cases in Malaysia itself, they realized that they had to take swift and urgent measures, and so they decided on this. They gave us some heads up before they did this, but they probably realized that given the severity and given the seriousness, this was something they had to do, and we understand why. I think if we were facing a similar situation, we would have to consider very stringent measures as well. So they did what was necessary, and as I said, something like this, a measure like this will cause inconvenience, will cause disruptions, but in some ways, if you look at it and what has been done, it will help to control the transmission of the virus across the borders. So we have to now deal with the consequences and make adjustments. How best to do so? We have already said goods and cargoes will continue to flow, so there is no need to be concerned about that part. There will be impact on people and workers who are commuting on both sides, we will have to adjust to this, because clearly under the measures that the Malaysians have put in place, there will not be a flow of people. When you're under the control measures that they have put in place, you cannot move even within Malaysia. So you're not supposed to have that kind of flow within Malaysia, so let alone across the border. Right? So if that is the scenario or that is the situation, then we have to adjust. And the way we are adjusting is to reach out to employers and have them reach out to their workers, as Minister Josephine Teo said, and we will provide accommodation for them in Singapore during this period. We have activated sufficient units. It can be short-term rental. First of all, as Minister Teo said, they can look to, staying with their family and friends in Singapore, but we have activated units, short-term rental that will be made available, hotels, dormitories, so there will be space available, and we are also helping employers to cope with the additional financial support. So if we do this, then I think our companies will be able to continue operating, and we can ensure that services within Singapore will not be disrupted. Your next question on global leadership. That's I think if you look at the overall situation, WHO has put in place guidelines and has been exhorting and continuing to push countries to not give up on containment. That has been a consistent message from the WHO, because it is so important given how fast the virus is spreading and given the likelihood that many more people in the world may well get it, that in order to reduce fatality and mortality, containment is so important. I mean, if you just do the math, if 20 to 50% of the world's population were to be infected, and on a mortality rate of 1 to 2%, we are talking about millions in the world dying, and a human tragedy that we will have not seen before in modern history. That's the magnitude of this crisis. So the WHO is right to call on all countries to double down on containment. Don't give up on containment so easily. And it doesn't have to be containment, then move to mitigation later. Both can work hand in hand, and both must be pursued in parallel. So because of that advice, I think you now see more and more countries realizing the seriousness of the situation, and you do see more countries pursuing actively containment and mitigation measures and doing their utmost to control the spread of the virus. And we must do our part in Singapore too. Doing all that, unfortunately, means that there will be more economic impact, because the stringent measures that are needed to save lives and to flatten the epidemic curve will lead to more economic impact. And the actions that you talked about, therefore, at the global level, goes beyond public health coordination now. There is also a need for economic coordination in terms of monetary and fiscal policies, because we do need to ensure that while we address the public health emergency, attention and global effort is also needed to tackle a growing economic crisis.
Perhaps I should elaborate a little bit further. I think each country will have its own unique challenges. The nature of the disease spread within each country is also different. The readiness and the capacity and capability of each country's healthcare system is also different. And therefore, each country will have to adopt a strategy that's suitable and reflective of its situation. So I think it will not be possible to have a universal set of measures that every country will adopt. So I think each country will have to assess, evaluate, and determine what is the best course of action for each country. And we mentioned earlier that for Singapore, what we do here also depends on what the other countries are doing around us, because as Minister Wong mentioned, a significant number of our cases are actually imported cases. So therefore, it's important for us to work with the countries around us as well as beyond to best manage the infection, the spread within each country, so as to minimize the risk that we will have imported cases. And advisory to Singaporeans to minimize the unnecessary travel is an important one, because today, even for countries or areas that have very few cases, it doesn't really give us a sense of a security that in fact there are no cases there. There are many factors. Maybe the detection is not as rigorous, or maybe the disease has not broken out yet. And as you can see in recent examples, the number of cases can climb very quickly within a short period of time. And if you are traveling overseas, you may be caught in between. And therefore, as you come back, you may actually import the infections back to Singapore. So we would therefore encourage Singaporeans to defer non-essential travels as much as you can, so as to minimize the importation of new cases. But beyond working with the countries around us, it is also important for us to also focus on what we can do in Singapore. That's why last week, 2 weeks ago, we started focusing on maintaining certain distance between our people. So we discourage large-scale events. We have guidelines for events, public events, and which we announced. And we also want to continue to explore measures, progressively step up these measures to maintain physical distance between people. And then this way, we will help to reduce or minimize the risk of transmission within our community, even if there are imported cases. So it's important for us to work with other countries. It's also important for us as a country internally to continue to introduce measures to minimize the risk of transmission. And I think if you remember a few weeks ago, our foreign ministers met, ASEAN foreign ministers met, and they discussed the possibility of ASEAN effort, coordination, and discussion on our efforts to battle this COVID-19. And this is in progress. I've discussed with several ASEAN ministers. As I mentioned, I discussed with my counterpart in Malaysia. In fact, this meeting was scheduled before the announcement of the movement control order. Fortunately, we have this meeting scheduled, so we were able to discuss the actions by Malaysia and what are the follow-up coordination that we could do. So I've also discussed with several other ASEAN ministers, and I've a few more discussions that have been scheduled. I think collaboration within ASEAN is an important effort towards our regional cooperation. Beyond ASEAN, we also need to work with other countries to see how we can coordinate, share experiences, exchange views, and also coordinate our collective efforts in battling this crisis. I'll ask Joe to elaborate if there's anything you want to add on.
Perhaps just to supplement a point that Minister Lawrence Wong made earlier regarding the housing options for employers. Actually, the employers have mostly been able to find accommodation options on their own. But a number have had difficulty and they have approached us, so several hundred or so. And by and large, we do have enough capacity to help them. So I'm confident that all of the needs can be met. It may take a little bit of time because you need to match them. The employers as well as their workers have certain preferences, and they may also be looking at accommodation at different price points. But I think in the few short hours that we've had to work on this, we've actually been able to match more than 10,000. So I'm confident that by the end of the day, any one of the affected workers that need to stay in Singapore will be able to find suitable accommodation. So that much I can add.
Yeah. Hi, Shobi from Zaobao. A few questions. Number one, Minister Wong mentioned that in terms of short-term rental, there will be some arrangements as well. Can I check whether there will be relaxation of restrictions? For example, the number of months, now it's the minimum number of months is actually 6 months for HDB. So would that be actually further relaxed? And also in terms of the number of people in a unit, would that actually be relaxed as well? That's one. Number two, we understand that there have been different in terms of the number of people who commute daily between Singapore and Malaysia, the stats seems to be different. Singapore is giving, I think, 300,000, while Malaysia said 400,000. So what should it be? And I think because Malaysia also include people who come here to study, so maybe we can have a more confirmed answer on the stats. Also, number three, for essential services, people who actually come here for to perform essential services also include, I believe, hospitals, healthcare workers. So will there be actually special arrangements for these people? Thanks.
Let me address the healthcare workers, and then I'll ask Minister Wong to talk about the HDB rental flats, rentals. For healthcare, public healthcare system, including in the intermediate and long-term care sector, we have about 1% of our workforce in the public healthcare system and the intermediate and long-term care system that do daily commutes. The hospitals and various service providers, employers are now working with the workers, with the healthcare workers, to see whether we can accommodate them in Singapore. We have sufficient accommodation to provide for them to stay in Singapore if they wish to, but some of them may decide to go back to Malaysia because of their family and many other reasons. And for those, we will allow them to go back, of course, and we will make arrangements for our from our current manpower resources to supplement whoever is not able to come back to Singapore. So I think we about 1% will be affected because they are daily commutes. And beyond that, we would provide as much as we can to encourage them to stay in Singapore, providing accommodation and so on. And for those who cannot, then we will rearrange our manpower resources to ensure that our essential healthcare services will not be affected. We can work out the number for you. Yeah. So for the total number, I think whether it's 300, 400,000 is still an estimate and also fluctuates from day to day. So I don't think we need to go into the very specific absolute number, but we always use about 300,000. So I think if, for reporting purposes, you can use 300,000 as a given number.
I think in terms of the numbers, it's not whether it's 300, 400 on a daily basis, it will move, it will vary. But what we are concerned about are the employees who are responsible for essential services within Singapore. We are in touch with the employers. The employers know who their employees are, and the employees then can make adjustments so long as accommodations are provided. For many other people, like you could have students, you could have other people who commute daily, I think they themselves can make adjustments. Many of them have family, have friends, have relatives on both sides of the causeway. So they will know how to make adjustments on their own, right? So the key focus for us is to touch base with the employers, whether it's healthcare, whether it's public transport, a whole range of different services. We want to make sure that the workers who are responsible for these operations are able to continue working, and that's why we are making these provisions. The provisions will include, because of the sudden nature of what has happened, we will certainly be prepared to be flexible on existing rules regarding occupancy in HDB flats and the number of months of rental, or the duration of the rental. Given the emergency, given the nature of this, and dealing with a public health emergency and dealing with the timing that we had to respond to this new measure that Malaysia has imposed, we will certainly be flexible. If the measure goes beyond 2 weeks, then by then I think we would have, because the Malaysians may well review and extend this measure. And if it is necessary, and if it goes beyond 2 weeks, I'm sure by then we would have sufficient units available for employers to put in place appropriate rental arrangements. So in the interim, for a temporary period, given the nature of what has happened, we will be flexible.
The lady in front.
Okay, Huimin from CNA Digital. So just wanted to check if you guys are concerned about the heavy inflow of Malaysians coming into Singapore before the deadline later tonight. Is Singapore in touch with the counterparts across the border on the situation at our checkpoints with a view to manage it over, tonight? Yeah.
Sorry, I didn't get the question.
Okay, sorry, I'll just repeat. So is Singapore concerned about the heavy inflow of Malaysians coming into Singapore before the deadline later tonight? And, are we in touch with our counterparts across the border to kind of manage the situation at the checkpoints with a view to how we're going to manage it for the rest of the night? Yeah.
Understand.
Thank you.
Yes, there will be a flow. Again, we don't know. Some may decide not to stay here, right? Some may decide, it depends on the individual. So we will reach out to the individuals. We will, through the employers, provide accommodations. And based on our sensing, there will be significant number, we think, who will prefer to just stay in Singapore and continue working rather than have to be in Malaysia and then unable to commute after that and not having a job. We think a significant number will want to stay in Singapore, and that explains why there is a flow. We are in touch with the Malaysian side to see if some flexibility can be, obtained for within the beyond tonight, 1-2 days, just to allow for that transition to happen. So that conversation is still ongoing.
Hi, Hiai from Zaobao here. A few questions. So, adding on to that question, so since Malaysia announced the lockdown, there have been an influx of people coming in. So, are we concerned that there might be more infected people coming into Singapore? Because there's already quite widespread community spread within Malaysia. And if so, this SG and Malaysia Task Force, have we come up with measures to put in place at the customs to ensure that these infected or suspected cases do not come in? Second question, regarding, PM said that the flow of food and cargo will continue, but how will it be done exactly? So will these people be allowed to come in? Will there be exceptions made, or do they have to dump the food at the custom and go and get it ourselves? Yeah, and also a third question. So the task force has previously said that we can't possibly lock ourselves away from the world. Yeah, but now with the situation worsening and many countries are actually locking down their countries, is it something that we are considering in the future, looking down at the road? Yeah, thank you.
Thank you. On the inflow of Malaysians coming into Singapore or transfers over the causeway, that happens every day. Even today, as Shobi mentioned, we have 400,000 every day. So we already have put in place temperature screening, and we also have officers who are observing. And for those, the advice is still the same. If you are sick, please go and see a doctor. If you are unwell, please go and see a doctor. And at our employers, they are also quite mindful now. If they see their employees not well, they will tell them to please go and see a doctor. And many of them will transfer over. Some of them may be Singaporeans that are coming back too. So it's the same thing. We advise them, if you are not well, please go and see a doctor as soon as possible so that you can be assessed. And you have given the MC, stay at home, and hopefully you will recover. If not, go back to see the same doctor again. So I think it's the same precaution that we have put in place since the beginning, and we will continue to do so.
The key is, these are the same people who have been traveling day in, day out for the last few days. So there is no new risk just because they are now all coming back, before the deadline. They have been coming in and out of, commuting between the two countries anyway, right? So there is no additional risk in that sense. These are not new people coming. We are talking about workers who are already working here. They have been commuting all this while. But now, because of the deadline, I think more of them are just trying to come over with their, whatever stuff they need to bring over, perhaps, in order to be able to stay here for 14 days and maybe even beyond, depending on what happens in Malaysia. So the existing precautions, the existing measures are there, and the key now is to make sure that as the workers come over, there's accommodations for them. And like I said, working out with the Malaysian side also to see if some flexibility over the next 1-2 days to manage the flow as these people come over. So that's the work that's happening. How will goods and cargo be delivered? Actually, we are still working that out on the Malaysian side because they too are working out the operational details. They have put in place a high-level policy move, but the detailed measures and how it filters down at the state level, they just met just this afternoon, right? So there are still many operational details that need to be worked out on their side, which they are still doing, and that's why we are constantly in touch with them to see how all of this will be operationalized and implemented over the coming days. Finally, on the lockdown, we can't rule it out, right? We can't rule it out because it will again depend on global and the local situation. We have always said that we need to consider a whole range of measures and not rule anything out. So something as stringent, we are not planning for it, so Singaporeans should not think of us as planning for it, but it is certainly a very extreme measure, and we don't think we need to get there if we do all the things that we have been doing and we have been advocating and we do them well. Then we will never need to get there. So we are not planning for it. We don't want to get to that scenario, but with the multiple lines of defense that we have put in place on the travel side, on border controls, through the contact tracing and through social distancing, and we do all three levels well, and perhaps for each of this we will constantly tighten up at the border, contact tracing, doing more, doing faster, social distancing, more stringent measures. Then we need not get to a situation where we have to do an entire lockdown of the city. That's what we are aiming for. We could potentially do, for example, what additional measures? We could consider a major circuit breaker that doesn't entail a lockdown, but entails school closures, entails workplace closures, and do it on a temporary basis, right, over a period of 2-3 weeks, just as the Malaysians have done, but it doesn't mean an entire lockdown. It means a major suspension of activities that would provide us a major circuit breaker. We have highlighted that as a possibility before. So these are a whole range of measures that we have in our toolkit, and we constantly monitor the environment, the risk situation, and then we will adjust our measures. And again, we emphasize we have to take our measures seriously, do them well, and if we are vigilant, we implement our measures effectively, we do not have to lock down our city, and we don't want to lock down our city.
I should just add that on the transfer of goods and cargo and food that you asked about, this is in fact one of the areas that the coordinating ministers, which the senior ministers appointed by the respective prime ministers, will be discussing. How can we coordinate the efforts in fighting the disease, as well as how do we coordinate the efforts of this arrangement to facilitate flow of goods and foods and supplies and so on. So I think this is an area of discussion. And at the same time, I should also add that the restriction order that Malaysia has put in is for 14 days up to end of the month. It could be extended. It depends on the situation. I would imagine they will assess and decide what else to do at the end of this month. But it's intended to be a temporary measure. It's not intended to be a total lockdown of the country for a long extended period of time. I don't think that is feasible either. So I think they will have to make an assessment. And for us, as I mentioned, it is very important for us to continue to see how we can introduce local measures within Singapore so as to minimize the risk of a transmission, especially taking into account that the number of cases, the rest of the world is still rising quite rapidly, and every day you see the number climbing. And therefore important for us, while we look at the border restrictions, at the same time make sure that our domestic measures will continue to be stepped up when necessary. So as Minister Wong mentioned, we are watching the development, watching the situation, and we will need to introduce measures as and when necessary, depending on the development of the disease outbreak, both locally as well as around the world.
Okay. Suhui from CNA. So Malaysia has just reported 2 deaths. What's your response to that? And is there an update for our patients in ICU? And another one is, how are citizens taking to government communication so far, particularly after PM Lee's latest video? Yep, thank you.
On the patient status, I think as I mentioned, death fatality is almost inevitable. Statistically, we have a global death mortality rate ranges between 2 to 3%, depending on what's the basis that you calculate on, and also it changes from time to time. Today, we do not have yet a death case in Singapore, but as I mentioned, the patients in the ICUs are all very critical, and we are monitoring them. Our healthcare workers are doing everything we can to support them so that they are able to recover as soon as possible and to the extent possible. But at some point in time, we do expect to see a mortality in Singapore as well. So we must be prepared for that eventuality. On the other question, maybe I ask Mr. Wong.
Well, we are doing our very best to communicate, putting out information as quickly as possible, using different mediums. The gov.sg has been very well subscribed. I think there is certainly a lot of interest in this topic, so people are consuming news around COVID-19 and the measures that we have put in place and continue to put in place quite quickly and readily. The challenge is that there is so much information, and this is moving so quickly. Almost every other day, we are putting out additional information. Just over the weekend, we put out a whole range of measures, and people were still in the process of absorbing the measures, adjusting to it, and then now you have to adjust to another reality when Malaysia puts in its own measures. So we have to get used to this tempo, and certainly during this period of time, right? Other countries may well impose additional measures beyond Malaysia, and it may well be good that they do, right? Because as we said just now, we do need all countries to take this very seriously, as the WHO has been pushing, and put in place strict containment and mitigation measures at the same time. And as more and more countries do so, there will be impact on our lives, there will be inconveniences, and there will be disruptions, and we will have to get used to it, and we will have to communicate that. And so there will be a lot of things to put out on a daily basis. So we hope Singaporeans understand we are trying our very best to put this out clearly, simply, effectively, and we certainly hope that members of the media will continue to help us to put it out in that same manner to Singaporeans and to the members of the public.
I think it's important to remind all ourselves is that information is very critical, and our task force and the government's position has always been to try to be as transparent and as forthfront as possible. We share as much information as we have, but you do understand that we need to confirm some of the information before we release them, and therefore press releases will come at a certain time. We will not be able to give you information before we can confirm. So it's important for us to ensure that the information we put out is as accurate as possible and as comprehensive as possible. We try not to hide anything, and whether good news, bad news, we share with all of you. So we hope that the media can also work with us to ensure that accurate information is transmitted to your readers, to your audience, so that we can have a good way of communicating. And it's also important for us to try to fight against fake news, because fake news, again, will distract a lot of resources for us to have to deal with them, to address them, to verify them, or to counter them. So I think if you can work with us, focus on the facts that we are putting out and help us share these facts, and we will continue to improve our communication channels as much as we can and to share as much as we can.
We have about time for 3 more questions.
Cheryl?
Hi, Mr. Josephine Teo. I'm Jia Yi from Channel 8 News. Just now you said that MOM is working with hotel and dormitories to provide lower cost rentals. So how much is the pricing Is it like lower 50% compared with the market price to ensure this is affordable for the affected workers? And let's say if Malaysia never lifted the ban, is beyond end of March, will this $50 financial support be continued to given to these affected workers?
So in terms of the housing options that are available to the affected workers and their employers, there is a range, and along this range, different price points. I was told, for example, that at dormitories, a night stay for each person comes to about $35. And some hotels, because they are more severely impacted by the travel restrictions around the world, they have seen the occupancy decline by a lot more than some other properties, some other hotels. I was told of a hotel quite centrally located that was willing to offer a room for $80. So employers who have put 2 workers in one shared room, that comes up to about $40 per employee. Of course, there will be other hotels and they will have to evaluate based on their own costs and also based on their occupancy, what is a suitable arrangement that they are prepared to offer right now and for what duration. It will also depend on whether these operators have got long-standing arrangements with their corporate partners. So there will be a range and we accept that. To add on top of the hotel options, don't forget that there are other rental options. We have a well-established rental market, and these rental options, there's a broad range. HDB flats are one of the options, but there are also walk-up apartments, there are also private condominiums. So we are very confident about the capacity, for workers that are affected to stay in Singapore, if that is the arrangement that is preferred by themselves as well as their employers. So as to whether this price point that you can find is suitable for them, I think it also depends on their willingness for each of these options that are open to them. Now, your second question is, what if this goes beyond 14 days? Yeah. So we will have to review this. A lot of it depends on what our colleagues in Malaysia decide, but we will keep in close communication with them and also monitor the impact on the businesses. Now, I should emphasize that this support that we are putting together for the companies is a temporary relief measure. So we put it out for 14 days, and what this does is to give the companies time. Give the companies time to do 2 things. One, we want to let the companies have time to assess for themselves what they want to see in terms of their manpower staffing, including the affected workers, and what will be more sustainable. 2, we also want to give the employers time to work out arrangements that will support their sustainable arrangements. So this is temporary. It is a relief package that gives the companies more time to work these things out. After all, they've had very little reaction time. They only got to know about it, some last night, some only realized this morning. But I must give them credit for being very responsive and also very responsible. We want to encourage them to continue to do so. Many of the firms that we have been in touch with are providing essential services. And their number 1 priority, they tell us, is they want to upkeep the level of service to Singaporeans. Now, because they are responding in such a responsible way, we want to support them. As for the other companies, we are also very mindful. They employ a lot of Singaporeans too. And if their businesses are disrupted, it affects their Singaporean staff as well. And during such time, we want to try and keep everything as stable as we can, in spite of the fast evolving situation and all of us having to make adjustments very quickly.
Hi, Min Zhang from Straits Times. A couple of clarifications. Just now, I think Minister Gan, you mentioned that about 1% of healthcare workers do daily commutes. Could we have an absolute number for that, a rough number? And presumably these are the orderlies and they are not doctors and nurses. Could we have some clarification on that? Minister Wong, you mentioned, I think, after border controls are lifted, presumably if they are lifted after 14 days, cannot go back to normal. And we might be working more closely with Malaysia. Could we have some elaboration on that, on what are some possible things that we could coordinate on? And last question is on why currently, as I understand it, we don't have any travel restrictions on travelers from the US. And we have seen a number of imported cases coming from the US in recent days. So could we have some idea of what's the thinking behind that? Yeah.
We'll check the number and let you have later on.
Thank you.
Second question was on...
You mentioned the border controls after they are lifted. We can't go back to business as usual, right?
Right.
Yeah.
So for now, because of based on the movement control order, quite aside from the people who may be able to come in for over the next one, maybe hopefully 2-3 more days in order to adjust to this new measure, basically we don't expect people coming through. After, if and when that is lifted, it cannot be that we go back to the usual arrangement. What were the new measures or precautions could be, what kind of precautions could be taken? Again, it's not something that we can decide unilaterally. That's why when we highlighted the measures we did last weekend, we said this has to be worked out bilaterally with our Malaysian colleagues. So we continue to discuss. I don't know what the shape of that will be. It could well be that we need a system to differentiate between the daily commuters who are moving, to and fro, versus those who are tourists, right? And they will be quite different. And then you've got to find some way to do that without causing too much congestion, some kind of a differentiated approach. Certainly, I mentioned over the weekend that if for the day, the ones who are commuting daily, if they are cleared through the checkpoint, then we also would like to see how employers themselves in Singapore, when they are working, can take extra precautions. So those were some of the things that we have been thinking about. But again, we now have to adjust to a new situation, right? It may well be that many of workers decide to continue working from Singapore. Then it's a different situation too. So it's really moving very quickly, it's dynamic, and based on following from today, we will be meeting with our Malaysian colleagues and we will continue the discussion to see what's feasible and what's workable on both sides. On the travel restrictions and border controls and whether or not US, or for that matter, whether other countries will be added on the list, we have always said this is not static. Every day we are looking at the risk and we are looking at the infection rate in different countries, as well as the risk of importation to Singapore. So we look at that very closely, and as and when there are updates, we will let all of you know, we'll let Singaporeans know. The updates can go both ways, because we've also said that we look at countries, and if there are countries where the situation has stabilized, we might adjust it the other way around. So for example, completely disallowing short-term visitors to now putting them on this 14-day requirement, right? So, and that can be done not just at the country level, but even at the city level, within a country. Very much like how we did it when we started travel restrictions. Remember, we didn't start, like with China, we didn't start with the whole of China, we started with Hubei, then we extended beyond. With Korea, we didn't start with Korea, we started with the affected regions, and then we extended. So in the same way as we calibrate up and down, we may do it not just at the whole country level, we may do it within the region, and then we will adjust in a very dynamic fashion based on data, based on evidence, and based on our updated assessment of risk.
If I can just add a small point. Actually, some people who have returned or come into Singapore from the United States have already been affected, because unless they come through a direct service, they would have had to have a transit point, either in Japan or Frankfurt, or sometimes even London. So if they have been to any of these intermediate points that are affected by the travel restrictions, actually when they come back, they are also required to serve the stay-home notice. So just keep that in mind.
The panelists will take the last question now.
Maybe the lady behind.
I'm Fatin from Reuters. Just a clarification on Minister Wong's comment about how there needs to be a global coordination in terms of monetary and fiscal policy. Can you just expand a little bit on that, and how would this work?
Well, the G7 have met and have been discussing this matter. At the G20 meeting recently, the finance ministers met together with the central bank governors. We also discussed this matter. This was in Riyadh. This was still at the early stage. At that time, it had not gone, the epidemic had not broken out in such a major way in Europe and America. So there continues to be close communication since then at the G20 level, but more importantly at the G7, where the major economies have been discussing. We are not part of the G7, and we are not also part of the G20. We just happen to be invited as an observer and to attend the meetings. So there is coordination happening, and clearly, given the fact that this is a twin crisis, it's a twin emergency, it's a public health emergency, it's also an economic emergency, an economic crisis. It is a crisis where I think for perhaps the first time in modern history where you have an economic crisis where supply chains are disrupted in a very significant way, and where international travel is grinding to a halt. So it is a very serious economic crisis, and that's why all the major economies are concerned, and monetary policies changes have already been made by some major countries, and I think fiscal policies are also being considered. We do our part in Singapore. We are not nowhere, we do what we can for Singapore. But if you talk about the global economy, then you do need the major economies with policy space on both the fiscal and monetary front to do something promptly, and I think they are certainly very seized by this matter.
Can you hear me? Yeah. Just to clarify, the 1% of healthcare workers is about 1,000. I would imagine the majority of them will be nurses and healthcare assistants. Some of them are Malaysians. Some of them may be Singapore PRs. They are Malaysians. They are staying in Johor or beyond, and they commute daily.